The American nurse forcibly quarantined in New Jersey over Ebola fears is going home. While in neighboring New York, a 5-year-old boy who fell ill after arriving from West Africa is being tested for the virus. This all comes as both U.S. states ease up on controversial mandatory quarantine policies. CCTV's Liling joins us live from New York with the details. And Liling, looks like we're seeing some compromise over these restrictions.
Yes, we are. The governors of New York and New Jersey are backing down somewhat after those stricter measures came under scrutiny. Now, the nurse who was held in isolation in a tent behind a New Jersey hospital, despite showing no symptoms, has complained about the way she was treated under the mandatory hospital quarantine policy. And those measures have also drawn widespread criticism from scientists, health officials, the White House, and the United Nations.
Casey Hickox was returning to the U.S. via New Jersey after spending a month in Sierra Leone as a healthcare worker. She was the first patient quarantined under the state's quarantine policy that had been in effect for a few days. It exceeded precautions adopted at the federal level. After several days in quarantine, she's being discharged and allowed to return home. But her case has fueled an already contentious debate about whether a mandatory automatic quarantine was necessary, a debate that has prompted both states to modify those restrictions.
If there are no symptoms, the state is implementing a quarantine at home. There will be monitoring twice a day by health professionals, but it's a quarantine that allows family members and friends to visit with the returning healthcare professional.
As the policy now stands, passengers who have been in contact with Ebola patients who are arriving in New York and New Jersey from the 3 countries hardest hit by the virus, Sierra Leone, Liberia, and Guinea, who are not showing symptoms, will be transported by private vehicle to their homes where they will be quarantined for 21 days. Officials will visit twice a day to check on their condition. Passengers who are showing symptoms will be transported via medical transportation to one of the designated hospitals that treat Ebola patients. For other passengers arriving from the Ebola hot zones who have not been in contact with Ebola patients, they will be handled on a case-by-case basis, but at the minimum, the health department will monitor their temperature and other symptoms for 21 days.
I understand that some people may believe the 21-day home quarantine is a burden. I would ask for their cooperation and understanding. And remember what we're trying to balance. We're trying to balance aid to West Africa and protection and the public health of New Yorkers and addressing the fear and concern of New Yorkers.
The change in policy came over the weekend as health officials and scientists criticized the previous mandatory quarantines for unnecessarily ostracizing health workers who volunteer their time and risk their lives to treat patients in West Africa. Critics say the policy could deter other volunteers from traveling to West Africa to help fight the epidemic.
And Liling, what has been the response from the UN?
Well, Anthony Banbury, the head of the UN Ebola mission, UNMIA, said that decisions should be based on science and fact, not hype and hysteria, while Secretary General Ban Ki-moon also criticized those measures, saying that returning health workers showing symptoms of Ebola should be supported and not stigmatized. And we also have an update on the Ebola patient here in New York, Dr. Craig Spencer. His condition is serious but stable. He did worsen over the weekend after presenting gastrointestinal symptoms indicative of the illness entering its next phase, but doctors say that was expected. Elaine?
All right, CCTV's Liling Tan in New York City.